Hello everyone, welcome back to the channel Obstressed, where we are going to talk about obstetrics, gynecology, and all the things which are going to stress you about it. So today's topic is forceps delivery. Before starting the video, I would like to wish everyone a very happy new year. I know there are few days still left in this year, but I would like to give you all an early wish, and I want this year to be a very happy and prosperous for me and you and all the people out there. So let's start with today's topic. Today's topic is forceps delivery. This is a very important topic because it has a very important role in the obstetrics practice, as well as it is an important and favorite viva question also. And we have got multiple videos showcasing how to apply forceps, how to get the delivery done by using forceps. We also get to learn forceps in some of the clinics also, because forceps is not much used these days because of the use of cesarean section pretty much early in the cases. But forceps is a very vital thing which every obstetrician needs to know, and that is why we start learning about forceps from our UG scenes. So it is an important topic for obstetrics and gynecology postgraduates, as well as for undergraduates and those who are preparing for the NEET PG. So in this topic, I'm not going to talk about all the techniques and how to apply the forceps and all that. I'm going to talk about the theoretical knowledge and the pointers which you need to know about forceps. And I'm just trying to make this topic easy for you. So if this video benefits you in learning about various points about forceps, then please leave a comment down below and please tell me what all topics you find difficult to remember, so that we together can make them easy to remember. That is the point, and that is the purpose of this channel, to reduce your stress. So let's start with today's topic. Firstly, the thing is prerequisites of forceps. These are the things which you need to make sure before applying forceps on any patient. And this is a very common mnemonic which is given in many textbooks, which is the name forceps itself. From F, we can remember fully dilated cervix. From O, it's occipito-anterior, occipito-posterior, or other favorite positions. Other favorite positions are mento-anterior and after coming head of breech. From R, we can remember ruptured membranes. From C, it is consent. From E, it is engaged head, experienced doctor, episiotomy, empty bladder, and effective. So we can remember it like that. E is the fifth alphabet. So from E, we have 5 points. Then P is showing position of head, and from S we can remember sagittal suture. Sagittal suture, the context here is that sagittal suture needs to be in the midline of the applied forceps, so that the forceps can be applied in a good way and we can lock the forceps in a good way. These all are the prerequisites of forceps. So if someone asks you what are the prerequisites of forceps, you can remember it like this. And these are the things which are necessary, and you need to make sure that these all are present before you are applying forceps for any delivery. Now, the second thing is, what are the indications of the forceps? So the indications of forceps are, first is the fetal distress in second stage of labor. As we all have understood and read previously also, that forceps can be applied only when the patient is fully dilated. So that is why we are applying the forceps in second stage. So we all are applying forceps when the patient has full dilated cervix but still the delivery is not happening. So it can be the indication fetal distress. Another indication, we can remember it like that, the most commonly it is the situation when the mother gets so much exhausted because she is pushing from so long. So first thing is maternal exhaustion. After that, why the mother is exhausted? So there can be the multiple reasons. So we can remember the maternal indications like this, that mother is exhausted, and the reasons for that are prolonged labor, that there has to be very long time from when she is in labor. Second thing is failure of satisfactory descent of head, that labor is progressing but the head is not descending. So failure of satisfactory descent of head. And we are doing this prophylactically so that mother doesn't undergo exhaustion, and we have to do it prophylactically to cut short second stage of labor in those situations where we want to prevent maternal exhaustion, or where maternal exhaustion can be very dangerous for her life. For example, in eclampsia, pre-eclampsia, heart disease, severe anemia, and multiple infective conditions. Another thing is after coming head of breech. Then two indications you have to remember, which are the special ones like mento-anterior. Why? Because vacuum is contraindicated in the face presentation and previous LSCS. So these all are the indications. Next point is contraindications. Contraindications are very, very important because we need to know when to apply, and the equal importance is given to the things when we shouldn't apply forceps. So when we shouldn't apply, so I have made a mnemonic for this, which is doctor, do not apply forceps. We have to remember it like that. From doctor, it is inexperienced doctor. Next, from DOD. From D, it is don't fulfill prerequisites. From O, it is osteogenesis imperfecta in the fetus. From not, it is not engaged head. From A, it is nothing but end. From P, it is position of head is not certain. That means you haven't made certain the position of the head because it is really important. From L, it is L say lal. That means bleeding disorder in the fetus. And from Y, it is have she yet said yes? That means consent. You need to make sure consent before taking down on the procedure like forceps delivery because it can be quite detrimental to the mother as well as to the fetus. So the mnemonic is doctor, do not apply. Next thing is difficulties in the forceps application. This is also a very, very important point, that at what level you can expect difficulties in the forceps. So we will remember it like that when we are applying forceps. So first thing is we can't even apply the forceps like in the application of blades. So there can be two things. We have two pointers, main pointers in forceps. One is the mother, one is the fetus. So here also we will have 2 points. One is the mother cervix, one is the fetal head. If the cervix is not fully dilated, then we can't apply forceps. If the fetal head is malrotated or not engaged, then we can't apply blades. First thing. Second point is in lock we have applied but we can't lock. Locking is difficult. So in locking we have 4 wrongs. 4 wrong points we have to remember. Wrong introduction of blades, that means technique is wrong. Wrong position of head, that means we are not applying correctly on the head. Wrong placement of handles. So when we lock the forceps, then the handles should be resting on the perineum, low enough to rest on the perineum. If we are not doing it correct, then forceps can fail. Fourth is wrong timing of cord entanglement. So there can be a complication that fetal cord entanglement occurs in the fenestrations of the forceps, which will lead to the forceps failure, definitely. So wrong timing of cord entanglement. These are 4 wrongs. Next thing is we have applied, we have locked, but we can't pull the baby out. That is traction. So during traction, we can face problems at 3 points. 2 points are of fetus, 2 points are of mother, and 2 points are from the doctor's perspective. 2 points of fetus are if there is persistent occipito-posterior position, if there is undiagnosed bro presentation, because bro presentation is also a contraindication of normal delivery. In bro presentation, you need to do LSCS. Second 2 mother points are 2 constrictions, constriction ring and contracted pelvis. And from 2 doctor points are wrong application of the forceps and wrong direction of the traction. Now the 4th point is we are applying traction but in between the blades got slipped. So there can be 3 reasons. If we have not inserted forceps properly, or we have not locked forceps properly, if the forceps are not well applied on the head, if there is persistent occipito-posterior position. Next thing is complications, which are also very important part. So the complications can be divided into 2 groups, maternal complications and fetal complications. I have made to learn, and at least I can say that I have tried to make them easy to learn. So this is maternal complications we have divided into early and late. Earliest complication can be injury to the maternal genital tract, which is laceration. But before that, we have to give some anesthesia or some blocks before applying forceps, which is necessary. So the first thing is anesthesia hazards. After that, it is injury. So injury can be laceration of the vagina, of the cervix, complete perineal tear, vault injury. These are the local. And there can be rupture uterus. So this is big injury. After that, there can be one more injury, that is nerve injury, like genitofemoral nerve injury. Now, After all this, if someone has suffered injury, then what will you expect to occur? There can be a hematoma formation, there can be PPH, that is postpartum hemorrhage, and due to all this bleeding, patient can end up in shock. So three complications are these, and due to all this, due to all injuries and bleeding, patient can end up with infections, generalized, or infections in the urinary tract, that is UTI, and due to that patient can have urine retention. Next thing is complications which are late but in the mother, and these complications are that patient can have pain. Most common complication is what? Pain. Patient can have prolapse because of definitely prolonged labor, that is why we are using forceps. And patient can have, due to the prolonged labor, or patient can have VVF, that is vesicovaginal fistula, rectovaginal fistula, or incontinence, urine incontinence and rectal incontinence. Next thing is fetal complications. So in fetal complications there can be hypoxia, which have to occur because we are applying forceps, and in the second stage if we can keep the baby for a long time, then baby can end up with hypoxia. There can be fetal injuries also, similar ones: laceration of the scalp, laceration of the fetal head, bruising of the fetal head, intracranial injury, fractured skull, capillohematoma, and rarely there can be the ICH, that is intracranial hemorrhage, and there can be nerve injury, facial palsy, Erb's palsy, and a very rare complication is cerebral palsy. There are many studies done which show that cerebral palsy have no direct correlation with the forceps delivery, but there can be the cases. So it is a complication, but it will present later on when the child will start walking and speaking, that is around 1 year and 1.5 years of age. So this was all about all the major pointers which can be asked in the examination, and you have to remember. I have tried to make them a little bit easier to remember. I hope this video has helped you. If it has, then please leave a like and subscribe to my channel, and please leave a comment about which topic you want me to make a video on next time. And again, a very happy new year. I hope you have a very good day. Until next video.